At the top of the year, the City of Tulsa hired its first ever Chief Mental Health Officer. It's part of the Mayor's Office of Resilience and Equity. Joining me this morning to talk more about her new role is Dr. Rebecca Hubbard. Good morning, Dr. Hubbard.
Good morning.
This is a new position for Tulsa. Can you tell us about what you've been doing now? This is 1 month on the job?
Yes, today.
What are you doing? What have you been doing?
So I've been getting acclimated, of course, to all of the responsibilities and expectations and hopes for the city. Mostly meeting with partners across the city to gauge where they're at, what their hopes are, what their dreams and goals are, what their next steps are. Meeting with both behavioral health partners as well as city partners like Tulsa Police Department, Tulsa Fire Department, Tulsa Health Department. Also developing some programmatic efforts that we have that we've received funding for. So we received a federal grant for Children's Mental Health Initiative.
Oh, okay.
And so we have been working to get that up and running. It's a Systems of Care grant directly to Tulsa, which is huge because it allows us to build processes and engagement that really works for Tulsa families and children. For children,
that's a big thing, isn't it?
Yes,
right? The next generation coming up.
Absolutely.
Tell us a little bit about your background. Obviously, in our conversation off camera in the commercial break, you're obviously very passionate about this. Tell us about your background.
Absolutely, I am very passionate. So I have degrees in psychology, counseling, and human development and family science. I have worked in domestic violence, developmental disabilities, with families, with substance use disorder, pretty much anything related to human development and mental health. I have engaged in those types of services. I've been a therapist and I've worked as a director of education and prevention promotion. I've done legislative consultation and advocacy. So I've really kind of tried to address mental health at all the systems, and that's what I continue to do. So you have that individual within the family, within the community, kind of that local community, and then you have that larger societal, cultural policy construct that also plays a part, and I try to address mental health at all of those levels.
Do you feel like people are more open to talking about their mental health now, and does that make your job easier? If they are, do you think there's more of an openness around mental health discussions?
They are absolutely more open. If there is a silver lining to COVID, it is that people are more open about mental health these days, which is vital. And the more that they are open about it, the more it's normalized, the more people feel safe to reach out and say, hey, I think I might be struggling, I might need help. So it really destigmatizes mental health challenges and enables people to get help. And I just think that that is a beautiful thing. And yes, it does make my job in some ways easier, and I'm excited about that.
What are some of your big goals for however long you're in this position? What are some of your big goals? We talked about the grant having to do with children. What are some things you'd really like to see start from the ground up that's just not there right now?
Sure. Well, there are so many efforts that are already happening, and I'm working with those as well. So the fire and police response to crisis in the city, I'm working to help support them.
Crisis response teams?
Yes,
yeah.
Yes, absolutely. Some specific efforts we're going to be working on, hopefully, are related around substance and opioid use disorder. So really getting out in front of that, helping prevent overdoses, helping people get into sustained recovery using critical time interventions, those kinds of things. We're also working on efforts to continue to work with people around their genealogy and understanding when they get feedback on what their ancestry is and what comes with that. So that's an exciting initiative that we're working on that will fall under me, and I'm really curious to see where that takes us. Just continuing to work with various partners. There's so much that is already going on. I don't know that we're really creating anything from the ground up, although there might be some efforts there. I think ultimately it's coming in and helping partners find their ways to kind of fit together so that we are this one cohesive response for the individuals out there that are needing help.
And then, of course, the mayor's talked about homelessness as well, and I would assume that's also going to be part of approaching homelessness from a mental health angle.
Yes, absolutely. So, you know, we have our 3H task force that the council is initiated, and it is vital for us to address that. As you know, we have we have made efforts for the low barrier shelter. We have a request for proposals out for affordable housing, and then we're talking with our partners. I'm engaging with them around how can we find those pressure points that we've never really been able to overcome, and how we use the city as a place of support to leverage and help that be addressed so that we can overcome those challenges.
A lot on your plate. Thank you, Dr. Rebecca Hubbard, for taking time to talk to us about your new role, the Chief Mental Health Officer with the City of Tulsa. We appreciate it.
Absolutely. Thank you.